In Ogun State, various changes have been going on since inception of the administration of Senator Ibikunle Amosun. As a result, improvements have been observed in the various sectors of the polity. One of the 5 points in the Cardinal Program is efficient healthcare delivery. This point has initiated transformations in the health sector to bring about qualitative as well as accessible healthcare delivery. In furtherance of this, the state government has started putting various measures in place to tackle emergencies and respond swiftly when such emergencies arise. One major concern has been that of road traffic accidents. According to the UN General Assembly, global road deaths and injury is a major public health problem with a broad range of social and economic consequences which, if unaddressed, may affect the sustainable development of countries and hinder progress towards the Millennium Development Goals. To this effect, the period between 2011 and 2020 has been proclaimed the UN Decade of Action for Road Safety. This was in a landmark resolution co-sponsored by 100 countries. Ogun State is one of the first states in Nigeria to take action towards actualizing the objective of this proclamation. It is one thing to make a promise and quite another to fulfill it. One such promise made by this administration is to provide ambulances and call centers that will quickly address cases of accidents and other health-related emergencies in the state. It was in fulfillment of this promise that on the 7th of August 2012, the State Ministry of Health played host to the citizens of Ogun State at a formal launch of the rebranded State Ambulance Service and Global Action on Decade of Road Safety. This it did in collaboration with the Federal Road Safety Corps and other major stakeholders. The event was held at the Arcade Ground Okemosong in Abeokuta, the state capital. In attendance were officers of the Federal Road Safety Corps, the Nigerian Security and Civil Defense Corps, the Nigeria Aid Group, the Red Cross, trainee nurses and regular midwives and nurses, royal fathers, and the good people of Ogun State. In his welcome address, the Honorable Commissioner for Health, Dr. Olaokun Soyinka, enumerated the importance of the launch and why the citizens should make use of the service being provided.
I welcome you all and sincerely appreciate the support you're showing for this exercise. This is an event which we are sure will mark the beginning of a major reduction in the incidence of preventable deaths from emergencies in our state. Although we are rightly pleased to be launching a rejuvenated fleet, which includes 4 new advanced life support ambulances just behind me here, I should point out that this is but a small part of the changing face of emergency services in the state.
Dr. Soyinka also expressed appreciation for the good working relationship established between the different stakeholders and expressed optimism that with the collaboration, many more lives would be saved in Ogun State. He announced the new emergency number for the Ogun State Ambulance Service.
In addition to our focus on training, we have also put in place a communication system to enable rapid response to all emergencies. Firstly, we have a fleet controller on call at all times, 7 days per week, who will be in contact with all ambulances and accident and emergency centers. Second, we are collaborating with the Federal Road Safety Corps, and I am pleased to announce that the use of the emergency number 122 that now works on all major networks is available for us to use. This number is easy to remember, and I believe it will result in faster mobilization in the case of emergencies.
The Corps Marshal and Chief Executive Officer of the Federal Road Safety Corps, Mr. Osita Benjamin Chidoka, in his speech, expressed delight at the steps taken by the Ogun State Ministry of Health and the Federal Road Safety Corps Ogun State Command at tackling emergencies.
Ogun State government is now a champion amongst other states in the Federation to launch the UN Decade of Action on Road Safety. If by this bold step, Ogun State government succeeds, then by the end of 2020, the current number of people that perish in the state will be reduced by more than 50%. And when we talk about reduction by 50%, it is important that I put it in context. The United Nations have asked us to reduce by 50%. But when I ask individuals, by how much will we reduce road safety in the world, they normally say 50%, some say 70%, some say 20%. And I said, in your state, by how many percent should we reduce? They say 50%, some say 20%, some say 30%. And I now say, in your family, by how many percent should we reduce it? And they all say 0. That they don't want death by road crashes in their family. And if we all don't want road deaths in our families, then that means that we should aim for 0 fatalities for road crashes in Nigeria.
He also commended the state government for the establishment of the Traffic Compliance and Enforcement Corps, popularly called TRACE. Goodwill messages were received from different personalities as well as groups present at the launch.
I want to congratulate the people of Ogun State for having a government that cares for them. And I want to assure you that when the road chief executive officer of the Federal Road Safety was reading his statement, he showed me that he promised me that they are having a zonal office at Ilaro and some other parts of Ogun State. I want to assure you that as royal fathers, we are going to support the global action on decades of road safety. And on this note, I want to assure you that in Yewa land, we are going to provide accommodation for the officers, a 3-bedroom flat for the officer you'll be sending to Ilaro.
The Ogun State standard that was first trained and being elevated on a high pedestal, we have our foothold on those steps to attain that platform of standard. Again, it is also for us to give a commitment that the response time that we had before would definitely move forward and be advanced with these provisions so that at any given time, depending on where accident or crashes occur, that we can have a timely provision to save lives.
I must commend the effort of our Excellency Ibekule Amosun for doing this kind of thing. I'm commending him in one way. This is the first time we have a governor that will be able to incorporate the effort of other paramedical organizations. I'm talking in terms of voluntary organization. We do hold meeting with the Honorable Commissioner, and that is the outlook of what you've seen today. It was a joint effort introduced by our able and Niger Governor, Ibekule Amosun.
When the government now brought this idea, we are very, very happy. It will boost the image of the Red Cross, especially, and the community. And even you see the ambulance being provided, it will serve a lot to the community.
Trainers from Critical Rescue International speak on their experience and the benefits of having such ambulances provided by the Ogun State government.
We've had the opportunity to do this type of training for other people, and for the Ogun State government to have come up with this kind of initiative, I think is quite commendable. It was really rigorous going through the periods we had the training, but at the end we all saw from the demo we had that it was a success.
Practice makes perfect, but with the skills they've imbibed, in any accident issue, I believe and I know they can handle it.
There was a practical demonstration of how the emergency vehicles are expected to work.
Okay, we have one more
The demonstration showed the kind of modern equipment available to quickly attend to emergencies. Speaking afterward, the Deputy Governor, Prince Segun Adesegun, representing the Governor, expressed the government's commitment to its 5-point cardinal program and the resolve to do more. He also noted that there is a need to address the spate of road accidents in the state.
There is the need to improve
on our provision of effective emergency services. It is worth knowing that out of the 4,065 deaths and 18,095 injuries recorded in 5,330 road accidents in Nigeria in 2010, 649 deaths, 1,533 injuries, and 1,980 accidents occurred in Ogun State.
He thus called on well-meaning Nigerians, and especially Ogun State citizens, to join hands and support such development.
As we launch these ambulances today, we call on well-meaning Nigerians, philanthropists, and corporate organizations to partner with us in this laudable project to attain our goal of having at least 42 life support ambulances to cover the entire state. Together, we shall take our state to desired heights.
After the speech, the Deputy Governor officially launched the rebranded ambulances. Still towards preparedness for emergencies, but this time on disaster management, the Ogun State Ministry of Environment and the Millennium Development Goals Office in the state organized the first Youth Brigade for Environmental Sustainability and Flood Disaster Management Training in Ogun State. This became necessary following the instances of floods in some parts of the state and the recent forecast by the Nigerian Meteorological Agency NIMET of more of such to happen from the month of August. The three-day training, which was held at the Abeokuta Grammar School, Idiaba, took place between Tuesday the 7th and Thursday the 9th of August 2012. The 200 participants of the Youth Brigade were drawn from local governments that are prone to floods in Ogun State, as well as men from the Nigerian Red Cross, the Civil Defense Corps, and the Nigeria Police. At the opening ceremony, the Honorable Commissioner for Environment advised the youth to take back home all they will learn, especially on refuse disposal, to prevent floods.
You're going to be lifesavers in your various communities, because the things that they're going to teach you here, take them back home so that if there are disasters, if there are flooding, you have to start putting them actually into practice. And I want you to please go a step further. One of the causes of flooding, the clogged drainages caused by our own activity. So I want you to please take as one of the things you have to learn here, that when drainages around your locality, ensure that they're not blocked.
The special advisor to the Ogun State Governor on MDGs, Mrs. Hafsat Abiola Costello, expressed worries over the prediction of NIMET, stating that the workshop was aimed at addressing the low levels of help, probably born out of a lack of training rendered by Nigerians during disasters.
When we have problems in Nigeria, I don't really see us going out and rescuing people. What I see oftentimes in the newspaper is us putting our hands on our heads, people crying, but where are the rescue operations? I mean, and even though we have rescue operations, I feel that we need 5,000, we have 500. Clearly we have room to grow. And the rescue operators cannot do it on their own anyway. In China, even the people, they have their organized committees that can help. And that's what we want it to be.
The director, Ogun State Emergency Management Agency, spoke on the importance of the training to the local government areas.
The essence of the workshop is to train the youth on how to respond to emergency situations in their local government, in their communities. So we have identified 6 local governments that are very prone to flooding in Ogun State, namely Abeokuta South, Abeokuta North, E4, and which is the most endemic area. Then Ado-Odo-Ota, then Yewa North, and Ijebu-Ode. These areas are very, very prone to flooding, and we have selected the youth from this local government to assist SEMA whenever there are emergency situation, mostly flooding in their community.
Various paper presentations were taken from stakeholders in the disaster and emergency field, including the Fire Service, the Nigeria Security and Defense Corps, and the Red Cross, amongst others.
That is where can we go together? Everyone bumps on my cheeks. That is the LLM. Look, I didn't design this like that. I didn't use this as
The trainees were given the opportunity to practice what they had learned in the class. On the 9th of August 2012, after the training sessions, the closing ceremony and presentation of certificates to members of the Youth Brigade was held. One of the trainers from the Federal Road Safety Corps spoke on the importance of being trained on traffic control and being alert during disasters or emergencies.
Make sure that the situation at hand does not get worse.
The representative of the Executive Governor congratulated the Youth Brigade and enjoined them to put in their best in helping humanity.
I want you to congratulate yourselves for being the first partaker. The special advisor has already given you all the advice that you need to ensure that you make a mark this project that you are embarking on from now. But I just want to add to it that individually you have to really express yourself so that your growth and your promotion individually, this project will be determined by the effort you put in.
Certificates were then presented to the now trained youths. At the end, the Special Advisor on MDGs spoke on whether the goals of organizing the workshop had been met, as well as the future of the brigade.
I think that they've gained a lot, but really it's only the first step. The plan is that when they go back home, we'll continue to work with them. We're going to do refresher courses for even this same group, and we'll be working with them and adding more and more, because the governor's goal is 5,000 people trained at local government and community level.
Those who were selected from the various local governments of the Youth Brigade were drawn from the various community development associations. They speak on what they had learned during the training.
We really appreciate the program because it has served as a kind of an eye-opener to most of us, because there are so many things we are learning here that we have been very careless about, like the issue of flood, the issue of fire outbreak, and so many of them like that.
They taught us how to clean our environment, how to tidy up all the gully erosion, or what they can cause disaster, and they told us how to conquer them.
I appreciate the state government for organizing a thing like this, and I will so much appreciate it if it continues.
Drawing from what they had learned, some of them cautioned people on proper disposal of refuse.
We have to go back home to sensitize our people that once there is rainfall, we don't have to pour our dirts into water, and simple precautions we have to take in case of fire outbreaks, and so many of them, like I said.
While commenting on the provision of ambulances, trainees and health officers describe it as a welcome development for the health sector.
I'll use this medium to actually appreciate the government, because the training were international based training, and it's fun consuming training, and I really appreciate them for actually giving us the privilege, the opportunity to actually go for this training. And we pray that and we plead to them that they should not stop the good work they've started, that we still need more ambulances and we still need more personnel.
The step taken by the state government is very good. It will reduce the deaths, the accidents on our road. And I so much like the initiative. It's very good.
Looking at this initiative, it helps the nurses out there, also the midwife, in order to know what to do at resuscitative levels in terms of emergency care and the necessary care to be given. Firstly, I know it's going to reduce the mortality and morbidity rate in the health sectors, and as well to know the resuscitative things to give at all levels as well too.
According to this trainee, such developments should be backed by law.
Let the Ogun State government make this type of a thing a policy, like a legislative law, so that no government will come up and eradicate it or remove them. Because we've started since maybe 19 something. A government came in and they abolished it. They want it to stay.
On the 6th of August 2012, a committee on Millennium Development Goals paid a visit to the governor of Ogun State, Senator Ibikunle Amosun. Topmost on the agenda was a briefing on the conditional cash transfers for pregnant women in some selected local government areas of the state. The special advisor to the governor on MDGs spoke on the aims of the project.
As you know, Your Excellency, Nigeria has 2 times the global average for maternal mortality. This very disturbing statistic is an indication of the fact that many of our women, 60%, Your Excellency, according to UNICEF, give birth without the aid of a birth attendant. This program will help the poorest women in our state, Your Excellency, to access primary healthcare facilities before delivery, at the point of delivery, and once after delivery. And with this kind of program, which will provide cash, food materials to help with nutrition, as well as important relevant support materials for delivery, these women can expect to give birth safely.
Considering the dismal statistics of maternal and child health in Nigeria, Ogun State is developing various measures to reduce maternal deaths and achieve the MDGs goals. As a result, the Ogun State MDGs office is allocating the sum of 169 million naira to be used for the program in 9 local government areas. They are Shagamu, Ikpokia, Ifo, Ijebu-Ode, Odeda, Obafemi Owode, Ado-Ota, Abeokuta South, and Yewa North. Responding, the representative of the concerned local government thanked both the Office of the MDGs and the Ogun State Ministry of Health for the gesture and promised that the desired aim would be achieved.
I just want to say thank you for this program, and I want to promise you on behalf of my colleagues that we will try our best to work in partnership with you people and make sure that we get the targeted audience, I mean the poorest of the poor, out of the pregnant women, and we hope it will be a success.
Speaking, Governor Ibikunle Amosun spoke on the vision of the state as regards maternal care.
We don't want people to die while giving, life to others. So I am happy that we are doing this conditional grant transfer for our pregnant women that will take care of them while they were pregnant, all their prenatal, even during childbirth, and I think to a considerable extent antenatal as well. So I can't wait for this to happen, and I'm happy that this is happening. I'm sure once this is done and it's proven to be very effective and successful, we will quickly look at the possibility of replicating this in the entire 20 local governments in Ogun State.
He added that while the state would not relent in its efforts to care for her people, all local governments should also do their part in ensuring that their people have access to healthcare.
The best way to achieve this is to go back to the basics, to the roots. And that is why you are the local government are the closest to our people. Of course, we do our bit at the state level, but for us to get to all what I call the grassroots, we have to use the local government, who in turn will now go back home and touch all their various wards. And that is why this relationship is very key. These complementary efforts of what the state is doing from the local government will only bring what I call development and protect this unnecessary death during childbirth, or probably even just immediately after giving birth.
For comments, questions, and observations, send a text to the GSM number displayed on your screen. Or send an email to be a part of rebuilding our beloved Gateway State.
Ọmọ Ògùn Ìṣẹ̀yà.